Welcome to the Consult Before the Cut, your go-to podcast for all things aesthetic, plastic surgery, and anti-aging. I'm one of your hosts, Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience in the industry, founder of Rejuvime Medical and Weiler Plastic Surgery Group, sitting here with Taylor Besh, right?
Physician's assistant, Weiler Plastic Surgery, and specialize in all things injectables.
Yeah. A veteran of over 15 years, one of the leading, I'm going to teach her on a little bit, one of the leading injectors in the state of Louisiana. Our little third partner is not here. She's on a trip in Disney with her young, wonderful kids. Anyway, she'll be back next week.
Celebrating her birthday at Disney World.
Yes.
My word.
Yes. And Taylor, today we are going to talk, we're going to focus on a certain type of chemical peel called Melanage peel.
That's right.
But we're going to kind of start the discussion a little bit talking about melanin, right? Which is the whole purpose of the Melanage peel, somewhat, to get rid of.
Correct.
Right? And tell me, you're a fertile female, right? Lady in still of childbearing age, and that's really one of the main sort of focuses of our people that get melanin.
Right. So what is melanin?
What is melanin? Let's talk about what melanin is, right?
Melanin is produced by the melanocytes.
Correct.
What the heck does that mean?
We'll say this. What is so? Let's bring it back one more step. That's the mask. A lot of people refer to it as the mask of pregnancy, right? Or
well, yeah, but that's more so melasma. What is bringing it back to melanin?
We're bringing it back even one more step.
Okay.
Right?
Melanin is produced by melanocytes. Melanocytes and the melanin in your body determine your tone, the pigment in your skin, the color of your skin.
Mm-hmm.
So everybody has probably heard of Fitzpatrick's scale 1 through 6.
Mm-hmm.
That is just basically a classification system of how much melanin you produce.
So take me through for our viewers and our listeners. Take me through quickly 1 through 6. What is a 1?
1 is like very, very, very fair, no
almost
color,
almost
yes.
Almost
no color to your skin.
What's her name? The actress.
Nicole
Kidman.
Nicole Kidman.
She would be a 1.
She'd probably be a 1. 2, maybe.
Yeah, maybe 2. But 1s are rare, right?
Yes.
But, almost a 1.
All the way to 6, which would be a darker skin toned African American or somebody that has a lot
significant
of
amount of pigment
in the skin.
Right? And
middle range 3 to 4. I would say I am probably a 3 or 4. 3.
Probably 3.
And that is, a decent amount of pigment. But the main thing we're focusing on today, yes, melanin determines your tone, but it can get wacky.
Out of control.
It can get out of control. And so that's what he was referring to. And that's what we're focusing on today is an overproduction of melanin can cause melasma. And everybody probably has heard of what melasma is.
Right.
Melasma is an overproduction of melanin, primarily seen in the face. And he said it is the pregnancy mask. And why is that? Because of hormones.
Hormones, right?
So hormone fluxes can cause melasma where you can have excess pigment here. A lot of patients talk about, my son asked me why I have a mustache. And so mustache, pigment along the jawline, which I have experience with all of my children.
Yeah.
It is truly dark areas on your face. Other things, sun exposure.
And I'm going to say something here. It's not something men get or even aware of that much.
Why?
Because I'll tell you why. Well, men don't get it because of the hormones. We'll talk about that because I got some risk factors or processes written down. But the other thing is, most men are naive to the process. And a lot of women wear a base. Right, and it evens the skin.
Oh, you're talking about men are naive to the girls having it.
Yes.
To the females.
And men don't get it either because of the hormone issues, and we'll talk about that.
Right.
But men aren't even necessarily. I don't think a whole lot of men are even aware of it. Like you said, why?
Yeah, because we hide it.
Yeah, hide it. Exactly right. So it's something that I see because I'm in the aesthetic industry. Right. It's something you see all the time because your patients come in for injectables with very little or no makeup. Right. But typically, like I had a lady yesterday for a facelift consult. She's been married for 25 years. She told me her husband has never seen her without makeup.
My gosh.
And that is not that uncommon. It's getting less and less common. But I've had multiple women. I've had women tell me they think their husband. My husband thinks I have eyebrows because their eyebrows are Like, what am I going to do? So
I need to step it up before.
no. Look, that generation is going away. It's probably good. You shouldn't have to wake up with a full face of makeup. That's just too much pressure. So, but I don't think a lot of men are that aware of the pigmentation issues that women.
I agree.
Women have
with that.
and women get, especially fertile women. And so, like you said, it's melanocytes, right? And it produces the melanin, right? And the risk factors. So a lot of it starts, to me,
risk factor for melasma.
For melasma,
yeah.
Risk factors for even over melanin production, right? Which is melasma. Is a lot of it's sun, right? And so, I think we've gotten a whole lot better as a society about
sunscreen and sun protection,
right?
Yeah.
But we still love the beach, especially here in the SEC area of the country, right? We still love to go to Florida, Alabama coast, right? Hormones. Huge.
Hormones, I think, is the number one
right?
thing.
You put in a woman pregnancy surge of hormones, throw in sun exposure, right? And throw in a genetic predisposition.
I was about to say, the three of those that you're done for.
And you are done for. You are done for.
Even stress, because stress increases your cortisol levels.
You're right.
That is part of the hormonal cycle.
Yep.
And you can absolutely see a flare with just being stressed out.
You tell me kids make you kids
Yeah,
are stressed?
right?
Especially, so you're pregnant with that second or third child.
Correct.
You've got 2 or 3 others. You go to the beach. You want to get some sun because you want to feel good.
Right.
You show back up.
Dark fat's better than white fat any day.
Yeah, exactly.
Right.
You show back up 2 weeks later, boom.
Yep.
What happens?
So patients come in, that is probably the number one insecurity that females have as far as their skin. And there's options for them. And it's a lot of times they're uninformed. They don't know what is going on.
Correct.
Majority of the severe cases have the mustache, and that is a huge insecurity for females.
Right.
So explaining them that, this is a process, this is normal. You're probably not ever going to beat melasma.
No.
But there's options that can keep it at bay.
My wife's going to cringe when I love this. So I always say it's like the Mississippi River. We could only hope to control it. We can't stop it.
Yes.
Right?
Yes.
We can
You're
levy
right.
it up. We can force it down. But, it's going to break through every once in a while, right? But we're going to put it right back and we're going to get it going.
Yeah.
So melasma for some ladies is a very, very difficult problem. It is something for ladies that have it out there. It will decrease, unfortunately, as you age because you will lose some of those hormones. So the problem may get a little bit better for some ladies. But it is a huge issue for ladies, 20s to late 40s and 50s and even beyond.
And I do see it improve sometimes postmenopausal, and I
Yes.
think it goes back to hormones. So
It does.
everything kind of, at the end of the day, hormones and sunlight.
Yeah.
But there are options to help dramatically with
Right.
in the improvement of it and keep it at bay.
Right.
So we'll dive into a couple of different options, and we'll bring on one of our estheticians, Sunny, to talk about the actual Melanage peel, which is absolutely amazing.
Right.
But treatment options.
Right. So, some of them you can start with just basic skincare, right? So obviously we talked about, UV radiation increases it, sunlight, sunburns increase it. So good daily usage of sunblock, right?
Every day.
Sunscreen every day.
Not in your makeup.
Right.
A true sunscreen.
True sunscreen, right?
They have hydroquinones on the market, and hydroquinones, think of that as a bleaching cream. It's a good short-term improvement, but not long-term. All that hydroquinone does is just basically push all of the melanin lower, deeper, so you don't see it. The second you stop using that hydroquinone, it is coming back with a vengeance. So it will temporarily improve, but you have to steadily, slowly get off of it.
My argument with that is there's other options besides hydroquinone to decrease your pigment, right?
Yeah.
That aren't hydroquinone based.
Non-hydroquinone based. So that is what I personally use every single day.
Right.
And that is basically slowing the melanocyte production of the melanin. And we carry a couple of those products at Weiler Plastic Surgery for daily use,
Right.
long-term use. That in conjunction with chemical peels, vitamins, it all has to be done together though.
Well, and so there's other options. So tretinoins
Yes.
can help.
Yep.
Right. So that in conjunction with, you can use hydroquinones or you can use a non-hydroquinone based skin lightener, right? Combining that with a retinol or a tretinoin And then also,
but that's just helping the carrier go down further,
pushing
that,
it down,
yeah,
right? Pushing it down. There's such things as a Kligman's cream, right? Which is a little combination of a hydroquinone, a retinol, and a steroid.
Yep.
Can help, right? Decreasing
Kojic acid
inflammation.
pads are the new
Kojic
thing
acid
as well
pads.
that we offer, which
Right.
is really, really awesome for pigment.
There are, if you look online or even in our office, we'll talk about microneedling can help. I love microneedling. I think it's a great, very basic aesthetic procedure that patients, it does so many things. And then some types of lasers can help. We certainly have.
We do carry lasers. Sometimes lasers can make it worse. So you have to be very careful in who you go to and go to a person who knows what in the world they're doing. But we do have lasers that absolutely help treat melasma specifically. I used to take, every time I'd go to the beach, something called HelioCare, which is just an over-the-counter supplement that slows the production of melanin. It can really help as well.
Yeah, a lot of it is hopefully prevention. Now you can't take away your hormones.
Right.
You can't change your parents. So genetics are predetermined, right? And so those really are some of the biggest indicators. But then there's other things like you said that you can do. But
I have this is off subject, a bunch of young girls who come in, they just started birth control pills.
Oh, yes.
And their face is flaring, and they're young, and it truly affects them. It's a emotional thing. So being able to help them, but they all have to be on board with the process. But we can absolutely help. Anything else before we bring on Sunny?
No, I agree with you. The young girls with the hormone surges, with the birth control certainly does it. I have seen patients develop it after like a simple breast aug. A young woman that has high hormones on birth control under stress can develop it too. Yeah. So stress is I don't think we understand how much stress affects our body. And there are
the silent killer, right?
Silent killer. Yeah. That's a whole nother topic. We're going to get into that one, though. Although we try to stay on happier topics besides the silent killer. But no, I think absolutely. So we are today, like you said, we're going to focus in on chemical peels, right? And specifically the Melanage peel, right? And so what we'll do here is, it's going to be a little bit of a shorter episode because we're going to bring our Sunny, our lovely esthetician in, and we're going to talk. And obviously you've had a lot of experience with being a Fitzpatrick 3 and having a couple of children. So, I'm going to kind of stay out. I'll ask some questions, but I don't have any personal experience with it. But we're going to cut to a break. We're going to come back, and then we're going to bring Sunny in, and we're going to have a great discussion.
That's right.
My name is Felicia Ferranti. I'm from Mandeville, Louisiana, and I had a breast augmentation. For me, I knew that I wanted to go natural. I knew what I was looking for. I remember finding Weiler's website, and I was like, this looks really natural. This is exactly what I'm looking for. Having my clothes fit is a life changer. Seriously, just nothing ever fit my shoulders, nothing ever stayed on me properly. That's all I ever wanted to do was just fill out my clothing, and that in itself, literally a dream come true. I know that sounds dramatic sometimes, but seriously, it is a dream come true.
My name is Josh Hughes. I'm 43. I'm currently on the HRT program. I just started feeling the effects of getting older, being tired all the time, not motivated, sore when I would do physical activity, and just needed a change. I've been on the HRT program for around 3 years. Within the first month, I completely noticed a huge difference in my mood and energy. The weight that I gained started to drop off rapidly. It just gave me a new lease on life. It made me feel like I was in my 20s again.
All right, welcome back to the consult before the cut. We would like to thank our sponsors before we get going here. We'd like to thank Rejuvime Medical, the age-defying clinic, your hormone and GLP-1 specialists in the state of Louisiana and Mississippi. Give them a call. We also like to thank the Weiler Plastic Surgery Group, the largest aesthetic plastic surgery group in the state of Louisiana. We have a whole host of wonderful surgeons. We have got great injectors. I myself, I'm part of the group, as is Taylor. And we would like to introduce...
A team of estheticians.
Team of estheticians, right?
Yeah.
We'd like to introduce one member of our team of great estheticians at the Weiler Plastic Surgery Group, Sunny.
Good morning.
Good morning.
Thank you guys for having me. I'm excited to be here.
Tell us, before we get going here, we're going to talk about the Melanage peel, but tell us a little bit about yourself. kind of where you're from, and then professionally.
Okay, so I'm originally from Denham, so it's right outside of Baton Rouge. I've lived here my entire life.
Okay.
Kind of started out in sales and in the business world and kind of shifted gears in my late 20s to do something that I loved, which was skincare. And
Right.
so I went back to school to be an esthetician, and now I'm full-time at Weiler Plastic Surgery at the Bluebonnet location.
So how
Here we
long?
are.
Yeah.
Here we are.
How long you been an esthetician for?
So practicing esthetician for almost 8 years.
Wow.
Licensed esthetician for right at 4.
Okay.
Yeah,
Okay.
that's good.
Well, good.
Yeah, started out doing lasers and then kind of really dove into more.
What is your take on melasma? I know on the break you already
She
corrected
was
us on
correcting
one
me.
thing.
She was correcting me
No, it
specifically, right?
wasn't-
No, it's fine. I'm not.
We
I'm
like
not
it.
master of all.
So guys can actually get it too. They're
Right.
very blessed. They can't get
Yeah.
things like cellulite. Their fibrous tissue bands run parallel, not horizontal. So they have that, but they actually can get melasma.
Melasma.
It's very, very rare, but they absolutely can.
Okay.
And if they do, they can also be treated with Melanage peel.
There you go. So, what is your experience? What do you think is the best treatment? I know we talked about a bunch of things earlier for
Well-
the treatment of melasma.
Yeah.
Well, let me ask you this. What do you, I always just take a step back. So what do you believe, what do you see with your patients causing? What are some of the risk factors that you see real world? Does that make sense? Like
Yeah.
people come in and I, oh my God, all of a sudden I woke up and boom.
Boom, it's there.
Because it's sunny, because I did this. What do you
Right.
see? What in the real world?
So you guys kind of touched on the hormonal part of it, but I also tell people a lot of what pops out and what you see is actually something that happened years ago. It wasn't something that you did 2 weeks ago while you're at the beach. Yes, that exacerbated it and made it worse.
That's what Taylor was telling me.
But a lot of times, especially, and I'll talk about this in a minute, whenever we do something like the Visia, you can really see that underlying sun damage that's underneath that you can't see whenever you walk up
Yeah.
to the mirror.
What is
so-
the Visia?
Oh, I knew you were going to ask it. I love it. So,
Oh, the Visia.
so if your local med spa does not have one,
Only
I
the
would
world's
really
best
try.
invention, right?
I would really try to locate a practitioner or a licensed esthetician that has something like a Visia. It's a skin analysis device, and it's absolutely phenomenal. Again, because it's going to tell us what's underlying. So when we walk up to the mirror, if I, as an esthetician, cleanse your skin, I can only see what I can see. But with the Visia, it's going to show us what's underlying. So it's going to show us that large amount of sun damage that you may have, that masky melasma that really isn't that visible to you, but you could have underneath.
So it's going to show the pigmentation, the melasma that you can't see. That
Yeah.
could
Correct.
potentially occur.
Absolutely.
Okay,
So
good.
there's a vascular
Wow,
component
okay.
to melasma. And I mean, I feel like
is.
a lot of patients would look at my skin and say, oh, I don't really see melasma. You put me under a Visia, and it's a perfect mask all across my face. Very symmetrical on both sides, like you were saying. A lot of times on the upper lip. But again, very symmetrical. You can cover it. But sometimes you can't really see it. And so doing something like a Visia eliminates a lot of future problems on if you're going to have a laser. So not all lasers.
Because the laser will bring that melasma to
So
the
it depends
surface,
on
is that
what
right?
type of laser it is. Yes, there are lasers that are designed and that have certain heat settings and things like that to where you can properly and safely treat melasma with them. A lot of times, though, even in my own experience, I've had a negative reaction from a laser whenever treating melasma. But yes, so
That is a good point. You don't do a Visia. You go in for a laser.
Yeah, you
no
get-
idea what's underlying, and then
you get it, and
Bam.
then it's exacerbated. I actually did that to myself. It was just very, very small on my forehead. Did a couple rounds of IPL. We all know and love IPL.
Right.
It ended up like breaking up the pigment and almost like spreading it. So it made it 10 times worse.
Yeah.
And then so
Yeah.
we went from a very small problem to, okay, this is a very large problem. I'm very self-conscious about this problem.
so that would be the first thing.
Yeah, absolutely.
Visia.
The Visia evaluation.
Figure out what's going
Exactly.
Okay.
Say you see melasma, you see a heightened amount of melanocytes on the Visia. What is your next step?
So I feel like it depends on the patient. If you are a patient who cannot have a lot of downtime, then we absolutely need to start with skincare.
Or no matter what, start with skincare, right?
Yeah, absolutely. But I also think if you're someone like me, who I'm like, okay, I've tried this cream, I've done that, nothing's really helping. That like I want to dive right into a treatment.
You want to get
something-
more aggressive.
Yeah, something like the Melanage peel. So it really, I feel like it's case by case on what a patient.
Well, let's talk about this. So, scenario: somebody comes in, they're naive, to estheticians and the aesthetic industry. They have a child or two. They show up at your door. They're late 20s, early 30s, and they've got that melasma, right? And what's your first go-to? Does that sort of make sense?
Yeah.
They've never had any peels or anything like that, any lasers.
Talk to me about skincare. What
Okay,
are you
good.
using? If you do not have a physical SPF in your regimen, you need to not leave the building without one.
And to translate, sunscreen, right?
SPF.
Yeah.
Sunscreen. Yeah. So other products, you talked about hydroquinone earlier. That's one that I really like. It's also not ideal for every single patient.
Right.
If you're more on the acneic side, not a great product for you. If you're more sensitive, some people have sensitivity to hydroquinone. So that's when you start talking to people about kojic acid pads like we have at Weiler. Those are absolutely phenomenal, very quick and easy to apply. But skincare is definitely the number one step. And again, SPF sunscreen is your
Prevention,
absolute
right?
go-to.
Is prevention. Wearing a hat if you're at the beach, right? Trying to avoid.
Yeah, and reapplying. Reapply till you die.
Reapply. I like that. I like
I've
that.
been using those products, seeing some results. I want a bigger result. What's next?
Melanage.
Melanage.
Yeah.
Okay.
We have two. We have the Melanage Ultra
let's talk
and
about
the
this.
Mini.
It's a chemical peel, right?
It is, yeah.
All right.
What is
chemical
that?
peel.
Yeah, there you
yeah,
What
so,
is a chemical? Tell me what a chemical peel is. Talk
so-
to me like I don't know what I'm doing here. So talk to me. What is a chemical peel? Talk about chemical peels. How do they work?
They work by shedding off dead and old layers of skin, and some of them address pigmentation, some more addressed fine lines and wrinkles and things like that. I think anytime you are considering doing a chemical peel for hyperpigmentation and melasma in particular, you can expect, if you're doing just a regular peel, to do a series.
Okay.
So the Perfect Derma Peel, we have boosters for those that target things like melasma. And then the Melanage Mini, that would be done in a series. And typically expect after the first one, the pigment almost looks a little bit more prominent than it did whenever you first started. And it's just a journey of evening out skin tone and suppressing those melanocytes over a period of time. But chemical peels, the ones that we have at Weiler Plastic Surgery, whether it's the Melanage or the Perfect Derma Peel, are safe for all skin types. Fitzpatrick's 1 through 6. So we have a lot of options as far as...
I kind of feel like chemical peels are somewhat forgotten these days. You know, people
I don't
are
really like that. I love a good chemical
No,
peel.
I do too. I think so many people focus on lasers and devices and things like that. I think that chemical peels are such a huge part and can be so effective. So somebody comes in and they've got melasma, right? And you're talking about how do you make the differentiation? How do you choose and say, hey, this is somebody that's going for a Melanage peel as opposed to something else? What makes you make that recommendation?
So I decide on how much downtime they have. If you are somebody who has very severe melasma, typically my go-to is the big Melanage peel.
Okay.
Just because it's more of a one and done, and it's really going to get the job done. When you have melasma and you do the smaller peels, me being a patient before becoming an esthetician and having it, you almost get a little impatient with waiting to see results.
With the smaller peels?
Yes, with smaller peels, and just in general with products and things like that. So if it's something that you are struggling with and you have that deeper melasma, I always push for just the bigger Melanage because the results they're there, you know.
What's the difference? So take us through the process, and what's the difference between the big and the mini?
Okay.
And how does it work? In simple terms. Someone like myself, in simple terms.
So the mini Melanage peel, you're going to do a series of 3, and they're going to be spaced 6 weeks apart. Both come with aftercare. The aftercare in the bigger Melanage is going to be longer. So you're going to have a 4 to 6 weeks of aftercare with the bigger Melanage versus the mini. You're also not going to peel as much with the mini.
Okay.
You're going to peel for about 5 to 7 days with the mini, whereas with the Ultra, you're going to peel 7 to 10 days.
So the mini is 3
Yes.
peels, right?
Smaller.
Smaller.
Yes.
How many weeks apart, you said?
6.
6 weeks with a peel time of 5 to 7 days, right?
Yeah, you're typically finished peeling by day 7.
Okay, and then aftercare on those is
Usually 4 weeks.
Okay, and describe aftercare. What does that entail?
So the mini Melanage does not come with everything that the bigger one does. It comes with your cleanser and then your soothing balm. That's just to kind of help, relieve any irritation that you're experiencing during the peeling process, and then an SPF.
Okay, and then the big peel. Talk to me about that.
Okay, so I love this one again.
The mega.
See, smile on your face.
I like it because it really is a one and done peel. And
Right.
again, if you're somebody who's struggling with it, it makes you very, very self-conscious. So when you know that there's something out there that's going to give you the results that you've tried all these other things, they're not working, this is perfect.
A lot of patients, when they're ready for the Melanage peel, I feel like they go in a little bit hopeless.
Yeah.
And to see them come out on the other side with such drastic, great improvement, it's
so rewarding.
Yeah.
It's so
I agree
rewarding,
with
especially, I feel like you and I both suffer with it, so we can totally relate to it.
Yep.
Okay, so aftercare with the bigger Melanage, you're going to take home a Melanage 2 cream. And so it has a true vitamin A, a true retinoid in it, and it also has arbutase, or arbutin. So that is a plant-derived. Its job is to lighten and brighten. So very, very similar to what hydroquinone is, but it's plant-derived, so it's going to be more subtle and gentle on the skin. So patients that experience like any type of discomfort with hydroquinone, arbutin is like the perfect alternative for that. Again, their job is to basically suppress melanocytes.
So on the big peel, so you walk in the door.
Oh, gosh.
All right.
Okay, let's talk about the process.
Let's talk about the process.
process.
Big peel.
Because I was unaware the first time.
Tell me about the process here.
Okay, so I
Because Taylor's been through it, right? How many have you had? Just one, Taylor?
I had one probably 6 years ago, but I recently did one.
Okay.
I know, look how good your skin's looking too.
It does.
Okay,
You do look
so at our office we do have the Visia, so I always love to cleanse the skin, and then we always do a Visia. This is a great way to just kind of see our starting point. We're going to do it again at 4 weeks. We're going to do it again at 6 weeks.
Sure.
But so I always cleanse the skin. The actual Ultra Peel comes with everything that we need. We degrease the skin. We put some protectant around the eyes, around the corners of the mouth, the nose, and then we apply a straight retinol directly to the skin. As you guys kind of know, a retinol's job is to help drive. I always tell people it's like the bus driver, right? It's driving all those other products down into your underlying layers where they need to go. And so everything that we apply on the skin is compounded in-house. So it comes with a white cream. It's called...
Okay, so the first is like you look yellow.
Yes, you look very yellow. It's like highlighter yellow
Yeah.
on
You
your
know,
skin.
the
retinoid.
The retinoid.
In a chair.
Yes,
Yeah.
she is painting
you yellow.
on your face, and
Okay,
you
so you're getting
look
painted
yellow
yellow.
first.
Okay.
Yes. So then we compound a cream
I think I
that...
saw you with the yellow on.
Yeah. I was seeing patients. Highlighter yellow.
Yeah, so then we have this...
How long is the yellow on? How do you leave it?
Well,
how
so-
It's
long?
usually immediately after, right? Where
What do
you
you
put
mean?
the white on top.
Yes.
Okay.
So then we top it with something, a cream that's white. You end up looking like Miss Doubtfire. That's what
Yes.
Taylor's talking about. She saw
I
patients
remember
all
that.
day with
Okay,
like
yeah.
a completely white pie face. So that's a combination of a number of different things.
Okay.
We mix in some crystals. Those crystals are actually freeze-dried acids like kojic acid, ferulic acid. So we mix that in. We also mix in some more retinol, and then we mix in some of that arbutin.
Okay.
We apply it all over the skin. Again, you look like
And that's
Mrs.
the
Doubtfire.
peel being
Yeah,
applied,
that's
right?
the actual peel itself.
Okay.
So depending on how severe the melasma is, skin type, skin texture determines on how long we're going to leave the actual mask on.
Okay.
So whether that's 6 hours, 8 hours, 10 hours, and then we typically write it on the top of a page.
Oh, wow.
That we
So it
send
can be
them.
left on for 10 hours.
Yes.
Okay.
The longer the better, really.
Right.
Yes.
Right.
I mean, I've heard of
Do you-
patients sleeping
Yeah.
overnight with
Do
it.
you, sensation, does it sting? Is it like a...
I think
Breezy.
when the white is on, it's fine.
It's fine.
Yeah,
I'm feeling
I
it,
feel
yeah.
like patients experience
Tingling?
literally
Nothing?
no,
nothing really.
Okay.
Yeah, it's
No.
a very, very comfortable anticlimactic peel.
Okay.
So it's not one of those ones where you're holding a fan and
Right.
you're like,
All this
oh,
build up
it's,
and you
Yeah,
just,
yeah,
but you're
yeah,
doing
yeah.
great.
No, it's really not
Okay.
bad.
So patients can typically experience maybe a little bit of warmth and tingly feeling after they rinse it off.
Right.
And typically the next day. The skin
Okay.
just feels real hot, kind of like a sunburn.
Okay.
Okay, then
Then what happens?
That doesn't end there.
Right. You got your mask
on day
on.
24,
You got your
so-
Doubtfire going
Well,
for
then
10
I don't
hours.
see you for 4 weeks.
Okay.
So, no, I'm kidding.
So what are you doing every day after that?
Well, how do you get the mask off? You wash it off?
Yeah, so
Good.
Is there anything
patients are instructed. We send you guys home with a sheet of paper of start to finish every single day. What are you doing?
Okay.
So the first day you're going to remove the Melanage
mask.
with the the Melanage mask with the foaming cleanser that we send home with you.
Okay.
You'll remove that, and then starting day 2 is when you'll start with the Melanage 2 cream.
Okay.
That's an additional cream that you'll use for about 4 to 6 weeks, depending on, what's kind of how your skin's playing out. Some patients are just more sensitive skin, and your esthetician can kind of accommodate, how your skin's reacting to it. Ideally, again, every single day for 4 weeks, and then we can kind of slowly start to taper off of it.
And it depends on how extensive their melasma is. If it's
Yeah,
terrible,
absolutely.
deep set melasma, you need to be using it.
Oh, yeah,
Yeah,
absolutely.
every day for
If
4
I
to
can get
6
6 weeks out of a patient, that's gold.
Yeah.
I understand it's hard to. Life happens. Some days we forget to do the cream. But again, patients are sent home with start
Is the
to finish
cream easy
instructions.
to apply, or is it visible, or what would be the?
It's not visible.
Okay. Why wouldn't
but
you
it
use
will make you continue to peel and be red and
It's
inflamed.
very superficial.
But it doesn't look like anything.
Okay.
Yeah.
I mean, you are red, peely, flaky for the duration of using that Melanage cream, in my experience.
So when does the business start happening? When is the peeling? Does that make sense? What?
So usually by about day 3, patients can start experiencing peeling. That
Okay.
typically happens around the nasolabial fold area 1st
Mm-hmm.
and kind of works its way back. Forehead is always the last to peel. I do find that with the Melanage peel, a lot of patients kind of peel around the mouth and chin area almost twice. So they get that good thick initial peeling happening, and then it is more of flaking after
Yeah.
that. I always explain it's kind of like if you've ever had a sunburn on your shoulder and you've scratched that kind of superficial, peely, flaky, dandruffy look. Expect to see that for about 3 to 4 weeks while you're using that Melanage
Continuously.
peel. Yeah.
Okay.
So that big shedding is typically done by day 10.
Okay. Obviously, you don't want to be pulling the skin off, right?
No, absolutely not.
Right. You want to let it
No.
fall off naturally.
That, or
right?
you can use tiny little cuticle scissors to cut it.
Okay.
So they have 2 other products with the Mega that
Yes.
you use to kind of combat the redness, irritation, peely, flaky.
Okay.
And that's the soothing and intense
Yeah, and intense
moisture.
soothing.
Okay.
Yeah. So that is placed on top of
On top of
the
peeling,
irritation to
irritates
keep
skin.
you, comfortable.
Right.
Yeah.
But yeah, the longer you peel, the better.
Yeah.
And you can control.
it's
the-
easier said than
So,
done.
and you
It
can
is.
control the peeling by applying the
Melanage.
The melon.
The Melanage 2 cream. Yes.
Right. And so maximum would be around 6 weeks.
Yes.
That's where, if you could get it, you want everybody doing that.
Yes.
For the
In
best
a- in a-
results.
yeah, absolutely. In a perfect world.
Taylor, how long did you do it for?
21 days.
That's pretty good.
But I'm going to use it. I have, parties coming
Right.
up. So I'm going to use it on probably twice a week and continue. My melasma wasn't terrible. I did it for melasma and texture. So I used it consistently for 21 days. And now I'm going to spread it out a little bit further.
Okay.
But continue to use it because it absolutely is, it's a great product. And
product.
obviously I want to see my full result. I do want to do a Visia at 4 weeks again to compare.
Yeah.
We can also put some pictures of, before and afters and show you the process because we did document, throughout. But it is the peel. It fits in perfectly for somebody who is battling with, I won't say severe melasma, but stubborn
Yeah, stubborn pigmentation, sun damage. And,
you do have to find a little bit of downtime to experience, the redness, peely, flaky. But I would say it's worth it.
Yeah, is it so bad you can't go around about your normal day with the redness, peely, flaky? Does it interfere, you feel like, a little bit? Or maybe interfere with, like you said, you mentioned parties.
I'll
and-
let you.
Yeah, what are your
so I
thoughts?
personally don't think so.
I from my standpoint, I love when my front desk girl is peeling.
Absolutely.
I feel like it's like walking advertisement when
I
you work
love
in
it,
this
right? I
industry.
love it.
Yeah,
when ladies in the
we
office are
don't
peeling.
mind it.
Right.
Patients love to, ask you, oh, what did you do? And
Exactly.
then I'm like always very
Yeah.
excited to talk about it. But
Right.
if I wasn't in that setting,
Correct.
I could totally understand
Yeah, if
and
you're an
see
attorney, you're CPA,
Yeah,
if you're
how a
running
patient or a
business,
person would-
hairdresser.
would
If you
want
did
to.
it on a Wednesday and you had the weekend, you had, Friday, Saturday, Sunday,
Because
because
that
that's
first,
the intense
that initial
peeling.
intense
Yes.
peel is the
Yes,
worst,
the
right?
first 3 days are definitely the worst.
And that's where
Yeah.
it's kind of that shocking, oh my God,
What did I do?
What did I do, right?
It's going to be
Yeah.
worth it. Trust
Right.
the process.
Yeah,
And
trust
then-
the process.
and then-
And a lot of people want to peel. They're paying for.
oh yeah, they want to see that peel.
Yeah,
Yes, people
Right.
are very underwhelmed when they don't peel. So
Right.
you're gonna get
very much so.
the peel
The
with
peel.
this.
Yeah.
And then it's sort of of a marathon of how long can you tolerate
That's
the
exactly
peel,
right.
the
That's a good way to
irritation,
describe
right?
it. I do
Yes.
agree with that.
How
I
far
think
can
that
you push this?
I think that patients that try to cover it up more tend to see it more. So
Right.
I always say if you're going to try to cover it up with something like nectar is really great. It's very soothing, very thick. And then a tinted SPF. If you're somebody who wears makeup every single day,
Right.
get a tinted SPF.
Right. But
Yeah.
but your recommendation would let it peel, right? Walk
Absolutely.
out and
Absolutely.
say, wear it loud and proud, right?
Yes.
Like I'm helping myself
Yes.
here.
Yes, it's
Yes.
going to look so
It's gonna
good.
look
6
so
weeks
good in
of a
6
lifetime
weeks.
battle with melasma
Absolutely.
is nothing.
Right.
And then
So-
once you get done with that process, that's when you go into those things like kojic acid
Right.
pads or
Maintenance.
yeah,
Yeah.
absolutely to keep it where it's at.
Yeah.
So who's not a candidate for this peel? Anybody?
Everyone.
Everyone is.
Everyone is.
Fitzpatrick 1 through
Through
6.
Good.
Which is not always the case. Not every Fitzpatrick is able to do a laser
yeah.
or to
Yeah.
do
The higher
a
Fitzpatricks
specific-
are limited in what
Yeah.
they can do.
Yeah.
I would say maybe the only patient that I would err on the side of caution would be a patient that has severe rosacea.
Okay.
Oh, okay.
Yeah.
Yeah.
Do you see any overall, in a higher Fitzpatrick, do you see any overall skin lightening at all? I know we're talking about melasma here, but do you see a little bit of lightening of pigmentation just generally or no?
I think you see brightening of
Brightening.
the
Right,
skin
yeah, that's
versus
better.
actual,
Yeah.
lightening of it.
Yeah.
Yeah, more
It's a
brightening,
good way to
just a
put it.
more even overall complexion.
Best time of the year to do this? Anytime?
Anytime for sure. It's harder in the south if you're wanting to do the larger Melanage peel.
Uh-huh.
You absolutely can do it middle of the summer, but winter months are definitely better.
Yes.
Sun exposure issue. Obviously, we're wanting to avoid sun exposure forever, right?
Forever.
In terms of you want to
But
wear a hat,
acutely
right?
in those 6
Acutely,
weeks.
though. Gotta be
Absolutely.
Yeah.
careful, right?
Very
Absolutely. Things you want to stop before, things like retinols. I always tell my patients to stop at least 7 days before.
Okay.
The retinol.
Yeah, just because I personally, if I use a retinol on a Monday, I start seeing effects from it Thursday, Friday. I kind of start getting a little peely, flaky. So 7 days is always my kind of let's stop active products. And you'll be able to resume those products again after that 6 week
What
period.
is the cost between a mini and
The
the
difference.
full?
So the mini is $450 for just one, and then $950 for the big one.
So $450 per each.
Per each. We do offer them in a series at a discounted rate if you purchase a
Series
series
of
of three.
three, right?
Yes, and then this is just $950. This is a one and done though.
Right.
This is you're going to do this once a year.
And the products that come in here, I wish that I could purchase Melanage
I know.
cleanser. I mean,
It's
it
the
is
best.
amazing.
And
It's
they're-
a full size cleanser.
And their SPF is my favorite.
Yeah, I know their products. You get a lot of products that come along with this as well for the $950. So
Now, how often should you do something like this? Depends on how much melasma you got. Or
This one can be done once a year.
Once a year.
This
Okay.
one every 6 weeks.
Every
and
6
I
weeks.
would probably do a series of this one once a year too.
Okay. To keep that melasma
Yeah.
at bay, right?
And you can always space it out too. If you purchase a series of them and you're really happy after doing that series, you could buy another package of them and you have a year to use them.
What are misconceptions people have about peels? What are things that you want to get out there that, hey, that ain't true? So what do you, people come in and tell you things or ask you things, you're like, oh, not that again. Is there anything like that?
I feel like there's a huge misconception on when people do peels on if they absolutely have to peel. Like you said it a second ago, there are chemical peels or people that do
Right.
regular things to their skin. They take really good care of their skin. They're naturally just not going to have big flaky sheds of skin falling off. Where someone, who doesn't have a good at-home regimen, has just thicker skin, is going to see more visible
do you
peeling.
see this not peel?
No, not this in particular.
Okay.
I have seen this. Not
Okay.
peel, but not sheets of skin. And
Okay.
typically when you say, oh, I'm getting a chemical peel, people expect to look like a lizard. You know, they're thinking their whole face is going to fall
I
off.
think you have that bad sunburn appearance when they were
Yeah.
12 years old, right?
Yeah.
That bad sunburn.
Right. I think that the best thing is to come in. We do complimentary visias.
Yes.
And start the conversation.
Yeah,
There's
absolutely.
tons of options. It starts with a Melanage peel. It doesn't end with a Melanage peel. So you have to maintain after with, there's an arboretum of different things. We talked about earlier, the toolbox. We have the toolbox. And it's not a one-stop shop. Melanage is a huge benefit to melasma.
Trying to
But
control it, and I can't get rid of it.
That's right.
We're trying to control it.
yeah,
right?
staying consistent with your skin care and then boosting it with the Melanage peel sporadically is amazing.
I agree.
Yeah.
Yeah, what else? Anything else?
No, I think one thing I tell patients, and consistency is key,
Yes.
right? Is
Yeah.
find your favorite esthetician. And if hopefully if you live in Louisiana, Mississippi, it's us. If it's going to be, you live in North Dakota, find your favorite esthetician, right? Buddy up with them, see them on a regular basis, right? You can get great results from small things done often, right?
Absolutely.
You don't have to do the big old giant things all the time. They do help, and they can jumpstart you, but it's amazing what you can do with a series of peels, a series of microneedling, all kind of things. And it's really just being committed to it, right?
I agree.
It really is. Well, good. Well, Sunny,
Thank
thank
you,
you.
Sunny.
Yes,
Guys.
thank you guys. We really appreciate great conversation. And we'd like to thank our audience. Thank you again for tuning in to the Consult Before the Cut, and stay tuned for our next episode.